around as quickly as possible. So everything here is no carts with the equipment that we typically see in ORs now, with lines running all over.
Actually, song and dance.
Interesting, ladies and gentlemen, good morning. First of all, there's signs on this podium. They're tips for all of us. I think one of them, the one I just dropped, says look up. This one says smile. We don't need a piece of paper to remind us to smile today in Humboldt. The sun is helping to take care of that, and so is the occasion for which we're all gathered here in this beautiful facility. Thanks, Yvonne, for the introduction today. I'm very proud to join all of you, and thanks for the invitation to be here in Humboldt for this very important day. I'm also proud to be with team members of ours. I'm a little biased, but you have a fantastic MLA here in Humboldt who has worked very, very hard on a number of projects in Humboldt and the surrounding area. She's been joined by Delbert Kirsch, the MLA from Batoche, who has also worked very hard for projects in this area and understands clearly that what's good for Humboldt is also good for his constituency in terms of services provided. And then again, we're also joined by the Minister of Health, Don McMorris, now the longest-serving Minister of Health in Canada, and I think for good reason. And I just want to thank Don for all of his work with respect to capital facilities. You're also served very well by a very dynamic mayor and a very good council here in the city of Humboldt. And I want to tell you that your mayor is very direct with the government in terms of the needs of this community. He's also fair at every turn. So while he works very hard on behalf of the community, he does it in a way that's constructive and fair and obviously gets results for all of you, and so do the council and the mayor. Thank you for that ongoing relationship. We acknowledge as well the folks from the Saskatoon Health Region. Appreciate the tour, Calvin, we just had. It was a quick one, but it's a pretty amazing facility that we're celebrating here today. You know, the city of Humboldt is like a poster city for the new Saskatchewan. Our last budget, the budget we tabled and passed yesterday in the legislature, was called the Saskatchewan Advantage. And because of all of you and our resources, not the government, but because of you, we have a unique budget in the country. Our budget's balanced, we're able to pay off some debt and lower some taxes and make some investments. And again, it's not the government's credit, but it's a credit to this new Saskatchewan of ours and all the people across the province, as well as our natural resources. This city, I think, is a poster child for the Saskatchewan Advantage, because the Saskatchewan Advantage is not just about the economy. It's not just about jobs, it's not just about attracting investment, it's not just about our province taking its place in the international stage in terms of trade. It's about quality of life. It's entirely the point of economic growth. We're not seeking it for the sake of pie charts and gross domestic product statistics. We seek growth so that we can invest in quality of life, so that we can invest together as a province in projects like this, so that we can work to reduce or eliminate the wait list of those with intellectual disabilities who are waiting for a group home space. And that's also being provided right here in Yorkton in a brand new project just adjacent to us. It's so we can invest in schools in places like Humboldt that are growing. That's why we want to have a growing and dynamic province. And we do, because of all of you. 100 years ago, the first hospital was taking shape in Humboldt. Construction on the original St. Elizabeth's building began in 1911 with additions over the years. The current version of the hospital, as you know, opened in 1955, 10 years before I was born. A century later, here we are, marking and celebrating the opening, the soon-to-be staffing and equipping, as soon as we move out, I think, of a $40 million complex, $26 million from the province, 14 from the region, and then the foundation that has just done a fantastic job of making sure that this hospital is all that it could be, with significant support from the Potash Corporation of Saskatchewan. Garth, it's great to see you here. Thank you to you, and especially to the employees who have made a $500,000 donation possible. 200 healthcare employees, 80,000 square feet, 34 acute care inpatient beds, 10-day surgeries that will actually help the Minister of Health's initiative to reduce surgical wait times across the province. You may have heard about this surgical wait times initiative, $40 million but we need to actually include regional centers like Humboldt in helping to deliver more surgeries. We'll use private partners, and we'll get that wait list down to where it should be. And that's very much a part of what this center is about as well. This hospital highlights also a different approach on the part of government. I would say where we honestly think you can't just announce things or put up a sign for things. You've got to roll up your sleeves, all of us, and get the hospital built and opened. And you've been waiting for a while, since 1999, for this to happen. We thank you for your patience and for your hard work in making this day possible. Ladies and gentlemen, of course, the structure here is one thing. It's very important. But we better also salute the people that will make this place hum. The frontline healthcare workers that serve this province so mightily and so well. We thank you in advance today for all the dedication you will commit to the people that will come through and need the services of this place, and to the families who care for those people who need the services of this place. Thanks for what you've already done, for what you're about to do. It's a great day in the city of Humboldt. Thanks for inviting us. Have a good day.